Okay, this is Brianna Jasper performing my IV skill. I've done hand hygiene, I've done 2 identifiers, I prepared my supplies and my patient with a towel. I'm going to hook up my saline lock, making sure not to contaminate anything. Okay. Going to take this off and expel the air. Okay. Back here. And I'm going to hook this up without touching. Okay. And then I'm just going to loosen this for later. Okay, I'm gonna bring my supplies close to me here. Okay, and my patient knows why I'm doing the procedure and everything. I'll take out my tourniquet. I'm going to apply it 4 to 6 inches above. I guess you can't see that very well. Okay. Okay. And okay, I see a good vein. Looks good. Yes. Okay, so I'm gonna loosen it. I'm going to apply gloves. And I'll clean my patient's site with chlorhexidine for 30 seconds. Going up and down and back and forth. And I would do this for 30 seconds. So 30 seconds are over. I would let it dry, and I would know that it's dry because it's no longer shiny. Okay, so it looks like that's finished. So I'm going to stall dry, reapply my tourniquet, 4 to 6 inches above again. Okay. I want to get my needle. Okay, so I'm gonna pull this off. I'm gonna rotate the bulb, just touching the blue. Okay, and then I'm gonna pull it right back down here. Okay, so I'm just going to touch my fingers in this one. Okay, I'm gonna let my patient know there's gonna be a poke here. I'm gonna grab the hand and pull the skin taut. Okay, just 10 degrees at most. Okay, here we are, parallel, flashback, so I'm gonna insert it just a 1/4 inch. Okay, and now I'm putting the catheter all the way in. Okay, now I'm going to occlude the vein, and I'm going to pull my needle out. I'm going to stabilize that. I'm going to enact my safety device. Okay, so that is being occluded and stabilized, and so now I'm going to loosen the cap without touching anything on my saline lock. I'm going to turn it into it, and now that it's on there, I don't have to occlude anymore because it won't leave, but I'm still going to stabilize my saline lock here. Okay, I'll grab my window out here, pull this off, and I'm not gonna touch the spot. Okay, and I am still stabilizing it. Have not let go. Okay, now my sight is in the window, and it's just barely on there, and I'm still holding on. Okay, I'm going to there we go. There we go. Okay. It's all on. I'm going to put that extra piece of tape now right over this. Make sure that it is stabilized fully. Okay. And so I'm going to make sure that it is patent. I'm gonna let my patient know. Here comes some saline. Okay, I'm gonna ask my patient if they're having any pain. I'm checking the site. I don't see any redness or swelling. And I would typically do this before I put on the dressing, but as long as there's no signs of swelling, redness, or pain, it's okay that I put the tape on already. So I'm gonna go ahead, make sure that's good. I would put the dressing and the date and everything like that on it. Okay, and this could be taken off earlier. Okay. All right, so then my patient is fully on. All that's good. I would then I would hook up like the IV stuff and everything, and I would, when I switch it, I would clean for 15 and let it dry for 30 seconds. Okay, and so that would be all on and together and stuff. And so then I would check on my patient 30 seconds. Okay, and now I've checked and I have orders to take my IV out. Okay, all that's good. So I'm gonna come in, I'm gonna see how the patient's doing. I'm gonna make sure there's no signs of redness, swelling, or pain. And so I'm going to start to slowly take off the tape in the direction of the hair. I'm gonna stabilize the catheter while I do that. Okay. Stabilizing in the direction of hair. Okay, still stabilizing. Okay, you're doing okay. So I'm going to put some pressure onto my patient with my gauze. Okay, and I'm going to pull out my catheter. Okay, I'm going to inspect it for any brokenness. Just make sure it's intact and good. It's all good, so I'm able to throw that away. Okay, and so then I would put pressure for 2 to 3 minutes or until my patient's done bleeding. Okay, and it seems like my patient's good, so I'm just going to apply tape, leave that on. Make sure it's good. Okay. Patient's got gauze taped to them. Okay, I'm going to make sure that they're doing okay. There's no bleeding, redness, swelling going on. Everything looks all right. I would document, clean up my area, and throw everything away. For hand hygiene, of course, before I would perform this part separately, but I already have my gloves on from that. So, thank you.